Section 2. What are the risk factors for musculoskeletal disorders?
But Victor, what are the causes? How do MSDs develop?
There are several different risk factors that increase the likelihood of developing MSDs. They are repetitive movements, awkward postures, static postures, forceful exertion, vibration, and any combination of the above. Let's take a close look at each risk factor. Repetitive movements means that you use the same part of your body, making similar motions over and over again too quickly or over an extended period of time. Repetitive movements place too much stress on the same set of muscles, joints, or tendons, which can cause a lot of wear and tear on them. And if you don't allow time for them to heal, damage can build up. Most repetitive motions involve hands, wrists, elbows, shoulders, and neck. For example, a data entry clerk whose job involves typing for long durations can lead to increased risk of MSDs of the fingers, hands, and wrists. Another example is assembly line workers labeling products, using a label tagger or scanning barcodes. The repeated motion of the hand to do the same action of labeling or scanning over long hours can also lead to increased risk of MSDs of the hands and wrists. Another factor is awkward postures, where the body, arms, and legs are not in their natural relaxed position. In order to understand the awkward postures, we need to know what good posture is. A good posture is one that places the least amount of stress on the joints and muscles. On the other hand, working with awkward postures, either for long durations or frequently, can place a lot of strain on the muscles, body joints, and tendons, which can result in aches and pains in the affected body parts. Typical awkward postures include bending the waist and twisting the waist. Squatting can be a good alternative to bending the waist, but only for a short period of time. After squatting too long, strain can build up in the knees and can eventually cause damage. Kneeling is another way to lower your body, but after prolonged periods, it can also cause pain, swelling, and stiffness in the knees. Another awkward posture is where the arm is lifted during work, or work is carried out with the arms and hands above your shoulders. Awkward posture can also involve bending the neck backwards, or forwards, or to the side. Bending the wrists downwards, upwards, or to either side can cause strain to the wrists. Bending the wrists is quite common when typing, using a mouse, or using certain hand tools, such as pliers or scissors. Equipment operators can have similar problems when using the controls of the equipment. Forceful exertion occurs when a lot of physical effort is needed to perform manual tasks. Examples are lifting, pushing, pulling, carrying, moving, and holding. Force is an important risk factor in contributing to the injuries from manual material handling activities. The more force or muscular effort that is required, the more strain will be placed on muscles and tendons in the hands, wrists, arms, neck, shoulders, and back. This can result in fatigue and also muscle soreness, which can further lead to low back pain, neck and shoulder ache, hand and wrist strain. There are 5 factors affecting how much muscular effort is needed or how much stress will be placed on the body parts while performing manual handling activities. They are weight of item, size of item, hand holes, posture, task duration and frequency. The weight of an object is usually a good indicator of the force needed to lift it. The heavier the item, the greater the amount of force is required. Lifting and carrying bulky objects increases the strain placed on the muscles and tendons of the back and arms. The further the object is from the body, the greater the force is required to lift it. Hand holes with proper design can make it easier to perform manual handling tasks. The lack of hand holes or improper hand holes, such as awkward-shaped or difficult gripping positions, can affect a person's ability to control and handle the load properly. This may result in a greater force needed to grip the load. Working posture is also important. Performing manual handling in an awkward posture, such as lifting loads below the waist level or above the shoulders, will increase the strain placed on the back. The same goes for carrying loads on one side of the body. The last factor is duration and frequency. Carrying or lifting items frequently or over an extended period of time can increase the strain on the body. Static posture means standing or sitting in the same position for long durations. When the body is in the same or unchanged posture for a long period of time, excessive stress is placed on particular parts of the body. For example, standing for long hours may cause fatigue in the muscles and the pooling of blood into the legs and feet. This could lead to painful and swollen feet, weakened muscles, and even varicose veins. Jobs or occupations where people are exposed to this risk factor include supermarket cashier, hotel receptionist, assembly line workers, office workers. The last MSD risk factor is vibration. Vibration is generated by vibrating hand tools. Vibration can be transmitted to the body during the use of the tool. Exposure to vibration of high intensity and over a long duration can lead to progressive damage to the nerves and blood vessels of the fingers and arms. People can be exposed to vibration when using drills, chainsaws, grinders, polishers, or jackhammers. Okay, Weetek, I've been talking a lot. I am going to show you 2 examples. Why don't you try to identify the MSD's risk factors?
Sure.
Jasmine, 29 years old. She is a laboratory technician at a pharmaceutical company. Her daily work involves preparing sample solutions and checking results using a microscope.
Does she use a mechanical pipette?
Yes.
Then she is probably exposed to repetitive movements from the frequent pressing action using the thumb.
Yes, you are correct. And there is actually a very common injury caused by repetitive movements, called trigger finger.
What is that?
People whose job involves a lot of repetitive grasping and releasing of an object are susceptible to this type of MSD. The first sign of trigger finger may be pain where the finger or thumb joins the palm. You may also notice some swelling. As the situation gets worse, you may have difficulty straightening the finger or thumb. Your finger or thumb may even lock into a bent position.
I see.
So, Weetek, besides the repetitive movements, might she be exposed to any other risk factors?
One awkward posture is when she has to lift her arm to do pipetting. And she has to bend her neck forwards when using a microscope. Also, Static postures from prolonged standing or sitting if she's doing these tasks all day. Not much forceful exertion though, unless she needs to transfer heavy containers of solutions or waste.
Yes, and sometimes the design of the container makes the manual handling tasks more difficult. Some equipment or hand tool designs that can make the manual handling more difficult include heavy weight, lack of proper handholds, made of glass, which can be slippery. Okay, let's take a look at another example. Eric, 35 years old. He works in the warehouse of a manufacturing company. His daily work involves counting and stocking inventory, monitoring product quality, and completing paperwork.
Does he need to manually lift or carry any heavy loads?
Lucky for him, the company has an automated loading and unloading system installed. So, not a lot of manual handling. But when customers place orders, he sometimes needs to repack products for shipment. For large orders, he will get a forklift driver to help him. For small orders, he will lift and carry a few boxes on his own.
Well, if the boxes are heavy and bulky, he could be exposed to forceful exertion. And if he reaches the boxes from storage racks above the shoulders or below his waist, he may also be affected by awkward postures.
Another task that he needs to do is checking inventory. For this, he needs to scan the barcode on each product.
Is this after product boxes have been transferred to the storage rack?
Yes.
But how can he reach the boxes which are either too low or too high?
Bending the waist, squatting, lifting, or raising the arm to reach. The storage rack is not very high and is still reachable.
But all those are awkward postures. And since this is his job, he's exposed to these awkward postures repetitively and maybe even for long durations. And this can make his work conditions worse.
Well done, WeTake. You're really understanding the risk factors for MSDs. Now I think you are ready to learn about how to control the risks.
Can I ask you a question before we continue?
Sure.
So we will have MSD when we are exposed to any of these risk factors?
Not exactly, WeTake. Whether or not exposure to these risk factors will lead to MSD's development depends on the duration, the frequency, and the intensity of your exposure. It means how long, how often, and how much. And MSDs are usually developed over prolonged periods of time. Symptoms can vary in their severity depending on the level of exposure. At the early stage, you just feel tired and the body aches. The symptoms are mild and may improve with rest. If exposure continues, microdamages accumulate and cause pain and swelling of the affected muscles, tendons, or connective tissues. You cannot perform routine tasks as efficiently as usual. At this stage, the symptoms are still reversible if they are being taken care of promptly and would require longer rest to recover. But at the late stage, pain could become so severe that the person is unable to perform physical work. Injury starts influencing daily life and work. MSD may or may not be reversible. And it can also be associated with a person's age, gender, and health status. For example, the older we are, the more susceptible we are to MSDs. So always keep in mind that the longer you are exposed to the risk factors, the more likely MSDs will develop. You are more likely to be injured if you are exposed to more than one risk factor at the same time. Always take the early warning signs seriously. It is better for us to take action to minimize the risks as early as possible. WeTake, now that you understand the risk factors for MSDs, Let's talk about what we can do to help prevent them from occurring.